Hi, everybody, and thank you for joining in on another episode of Medicare Matters with Mackenzie. Today, we're going to be taking a break from talking to providers, and we're going to talk about Medicare, specifically Original Medicare, what that is. And my goal by the end of this is so that you have just enough of a working knowledge to know when something's too big good to be true, when something's too good to be true, or maybe isn't all the way true, or is flat out wrong. So let's get started. So what is Medicare? Medicare is a federal program administered by the federal government. It's also part of the federal agency known as Centers for Medicare and Medicaid Services. We just refer to it more commonly as CMS. And what does it cover? Well, it covers more than just Parts A and B, which is Original Medicare, but today we're going to be focusing on just this. So are you eligible to enroll into Medicare? Well, if you are turning 65, as long as you or your spouse have worked in the U.S., paid federal taxes for 10 years or 40 quarters, you're good to go. You also have to be a U.S. permanent resident for 5 or more consecutive years, and those 5 consecutive years have to be the 5 years right before you enroll into Medicare. If you're under 65 and you're receiving Social Security disability, then you have to wait 24 months from the time that your disability starts, and then it will start on the 25th month. At any age, you are eligible if you have end-stage renal disease or Lou Gehrig's. At any age, you are eligible if you have end-stage renal disease or ALS or Lou Gehrig's. So when can you enroll? When you turn 65, you have a 7-month window. It's called your initial enrollment period. This is 3 months before your 65th birthday, your 65th birthday, and then 3 months after that. So if you enroll in the 3 months prior to the month of your birth, then your Medicare A and B will start on the first of the month that you were born. If you apply the month of your birth, then it will be effective the first of the following month, and so on and so forth. The last date that you can apply for Medicare will be in that seventh month, and then your Medicare A and B will start on the 8th month. Now, what if you're still working? If you're still working, don't worry. You have what's called a special enrollment period or a special election period. You can enroll into Medicare Part B up to 8 months after your group coverage ends. And then once you start Part B, you have an additional 2 months to sign up for any additional coverage. Now, I hear a lot of people say, hey, well, what about these penalties? As long as your employer coverage is creditable, meaning it meets the Medicare standard Medicare minimum, you are good to go. If you are working for an employer that has less than 20 employees, then typically that's not seen as creditable. Or if you have Marketplace or Obamacare, then you must sign up for Medicare when you turn 65. If you remain on those plans, then you're looking at a penalty, and you could be penalized for not having Part A, Part B, and then also Part D, which we will get to on another episode. What if you miss both? Well, every year is called a Part B general enrollment period. This is from January 1st to March 31st. And if you enroll in January, then your Part B would start in February. So the Part B always begins the month after you enroll. So you have it from January 1st to March 31st. This is a Medicare card. It has your name, typically the name that's on your Social Security card, your Medicare number, which is a combination of letters and numbers. It used to be your Social Security number, and then it followed by a letter that said how you were receiving your Social Security benefits, but they replaced it with this to help keep your information private. Now, still treat this number like it's your Social Security number. Don't give it out over the phone. There's been a lot of spam calls, and they're telling people, hey, you have to activate this card. You don't have to do that. As soon as you have the card, and as long as your Part A and your Part B has these dates, it's going to be effective from the start of whatever that date is. So don't give it out over the phone. It definitely doesn't have to be activated. So the 2 parts of Original Medicare is, first is Part A. That's your hospital insurance or your inpatient services. Part B is your medical services or outpatient. So what does Part A cover? So Part A covers inpatient hospitalization, room and board. or operating room costs, not the procedure itself, but the room. It covers skilled nursing facilities, home health, hospice, and blood. How much do you pay for it? Well, as long as you or a spouse have the 10 years, 40 quarters, then it's premium free. I mean, don't get me wrong, you've been paying into Part A your entire life, each month. That's what that part of that Medicare tax goes to. If you don't have the work history, then you can use your spouse's. Part A is typically free, no cost to those who have that work history. If you have no work history and you can't use your spouse's, then you'll have to have a premium. And then if you have maybe half of it, then you would still have to pay a premium. It won't be as large as if you didn't have any work history and couldn't use anybody's to help with that. So for inpatient hospitalization, I'm going to go into this. You don't need to remember all of these numbers. Now, this is kind of getting into the nitty-gritty, but a lot of people think that they can just have Part A and Part B and they're good. They don't need any additional coverage. And I'm here to show you why. I'm putting some data behind what I'm saying. So for inpatient hospitalization, this is room and board, okay? We're not talking about surgeries or doctors or anything like that. For the first 60 days, these are each benefit periods. For the first 60 days, you have a $1,676 deductible in 2025. Now, as soon as you're admitted into the hospital, that's when the deductible starts. You can go in or out of the hospital as much as you want, although I would recommend not going in or out too many times. This is all that you'll pay for room and board. Now, everybody gets 90 consecutive days of inpatient room and board coverage a year. So if you're in the hospital for 60 consecutive days, and then you're going into 61 through 90, then that becomes $419 per day. Now, you may think, well, I would never spend entire 90 days consecutive in the hospital, so that doesn't really apply to me. Well, it's not as common, but I've definitely seen it. And I've been doing this since 2017, and I've met about 4 or 5 people that have gone through all of this. So if you go through all the 90 consecutive days, then you're going into days 91 through 150. Now, these are what are called lifetime reserve days. So once you use one, you can't get it back. So for each of those days, you're paying $838 for room and board. Now, if you happen to use up all of those, and again, you may be thinking, this doesn't apply to me. If I'm ever in the hospital that long, just take me out of the hospital. I have met people that have gone through their 90 consecutive days and all 60 of the lifetime reserve days. So that means for each year for the rest of their life, they only have 90 days of consecutive coverage. Now, going back to the first benefit period, the days 1 through 60, the deductible, if you get admitted on day 1, you get discharged on day 30, and then you get readmitted, but it's day 61. That's an entirely new deductible period. So you have to meet that $1,676 again. Now that's a lot of money. And this isn't even talking about, like I mentioned before, doctors, surgeries, anything like that. So also with Part A, you have skilled nursing facility or a rehab. So if you had a surgery and you needed more care than just going home, you needed more medical attention, then you would go into a skilled nursing facility. The first 20 days, you don't have a copay. After that, days 21 through 100, you're paying $209.50 a day. Now, if you happen to go through all of those, then you pay 100% of the costs for days 101 plus. Also, what Part A covers is home health care. Typically, this doesn't cost you anything. The only thing that you would really have a cost for is durable medical equipment, medical supplies, bandages, things like that. But that's typically covered under Part B. Home health care is typically approved on a 3-month basis. And again, you do have that 20% coinsurance for that durable medical equipment. Hospice, there's no cost for it. You can go to and use any hospice facility that works with Medicare. Now, the only cost that you would have would be for respite care. So if you have somebody come in either in the facility or at home, and they're coming in and giving your family members a little bit of a reprieve, maybe they're staying with you overnight, then that would be an additional cost, as well as medications that are not covered under your hospice program. So what I'm talking about is let's say you have COPD and you are in hospice because you have lung cancer. So some of the medications, some of the inhalers that you were using for your COPD are now being used to help treat the pain of your lung cancer. But let's say you also have high blood pressure. Those medications you still have to pay the cost for because it's not directly related to the diagnosis for the reason that you're in hospital, the reason that you're in hospice. So those would be the only two. Now for blood, you have to pay for the first 3 pints. After that, Medicare picks it up. Now, if somebody donates the blood for you, if they get it from a blood bank, as long as they don't have to pay for it, meaning Medicare, then you shouldn't have a cost. But that is what Part A covers. So now you're saying, okay, well, I know that it covers my hospitalization. I know, if I need home health care or if I need more serious medical care attention, it helps cover the skilled nursing, it covers blood. What else does it cover? What about the doctors? Well, that's where Part B comes in. So Part B covers your doctor services, outpatient care, durable medical equipment, and preventative services. So in 2025, the monthly average premium for Part B is $185 a month. Now you can pay more than this or you can pay less than this, and that depends on your income, and we'll get there later. You have an annual deductible of $257. Once you pay that $257, then Medicare pays 80%, you pay 20%. So while you're in the hospital, every single doctor that comes and works on you, every single surgery, everything is 20%, 20%, 20%. And the only thing that those charges add to is the total. And there's also an additional cost. So if a doctor, because with Medicare, the billing is all individual. So each individual doctor is going to bill Medicare separately. So if that provider that works on you does not accept Medicare, then you are subject to the Part B excess charge. Now, this is state specific. We are here in Texas. I'm here in Texas. And so Texas does allow that excess charge. So that excess charge would be an additional 15%. So if the charge is $100, you have to pay the 20%. So that'd be $20. And then the remaining 15% of that would be $15. So your total cost would be $35 instead of $20. That $100 at $35, that's such a small amount. But if you get a larger bill, then 20% of a larger number is going to be greater than 20% of a smaller number. So just really need to look out for that. And then it also covers preventive services at $0. So these are things like your your annual wellness visit. Now, Medicare itself does not cover a physical. Medicare doesn't cover a physical. It will cover a wellness visit. And the difference there is typically the physicals are done by a doctor, whereas the wellness can be done by a PA or NP, something like that. It all goes back to coding. So I mentioned you can pay more than $185 a month for your premium. And this is how. The Part B IRMA. Now, IRMA, I know a couple IRMAs. They're nice ladies. This amount isn't quite so nice. So IRMA stands for Income Related Monthly Adjusted Amount. And this number is based on your modified adjusted gross income from 2 years prior. So the numbers I'm going to be showing you shortly are based on your 2023 gross income. So in 2026, that premium will be based on your 2024, 2027, 2025, and so on and so forth. So the numbers here represent the Part B IRMA premiums. So this is going to be based on your premiums from 2023. What your income was in 2023, that will be your 2025 premium. So for example's sake, let's say you file jointly, and in 2023, your income was $300,000. So that automatically puts you in the $370 range. That's what your Part B premium is going to be. So in 2023, you made $300,000, but This year, you make $100,000. If that higher income no longer applies to you due to work stoppage, reduction, divorce, annulment, and some other situations, then you can appeal that. And so this can fluctuate. But let's say that $300,000 was due to capital gains. Let's say you sold some property, sold some stock. And even though your income in 2025 is $100,000, you can't appeal that. Capital gains is one of the only ones that you cannot appeal. So you're stuck having that higher premium. Now, the next year, if you didn't have any capital gains, then you're good to go and you're able to appeal that. So what doesn't Medicare cover? Medicare doesn't cover prescription drugs, but there is some overlap between Part B as in boy, the medical, and Part D as in dog, meaning the prescription side. Chemotherapy is something that is covered under Part B, some steroid injections. Essentially, anything that is an injection and is given to you in a doctor's office, there's a likelihood that it could be covered under the Part B. So an example of this would be if you have an insulin pump. That's a piece of durable medical equipment. And so then the insulin for that is going to be a durable medical supply. And so that would be covered under your Part B. Whereas if you had insulin, not a pump, then that would be covered under the Part D, the prescription drug portion. So there's some overlap there. It doesn't cover out of the country care. So Medicare will cover you as long as you are in the United States or its territories. It also doesn't cover routine eye care. It will cover an eye exam if you have glaucoma or diabetes. It'll help cover that. Also, it does cover cataract surgery. And so after cataract surgery, not after each surgery, but just after you're finished with both, you get one pair of glasses that Medicare will cover. Also related to cataract surgery, Medicare only covers the most basic lens. So if you want to upgrade that lens, that would be an out-of-pocket cost. It doesn't cover hearing aids. It'll cover a hearing exam, but not the hearing aids. It doesn't cover routine dental care. Now notice it says routine. So if you are in an accident or something happens and your teeth, you need dental care related to a head injury, something like that, then that would be covered. But there has to be a determination. They're not going to just cover it right off the bat. And so you have to talk to a dental surgeon that does work with Medicare. And Medicare also doesn't cover long-term care. The closest that Medicare gets to covering long-term care is a skilled nursing facility and home health care. Now, but there are limits for each. I have had an individual who was a paraplegic and he was able to get, his home health care renewed on and on and on each 90 days. But then, even then, they came out every couple of days to help give him a bath, help change his, if he had any bandages, help change any of that. So it's not round the clock care. The other way that you can get long-term care is through Medicaid and having Star Plus. But Medicaid is a state-run program, and in order to have that Star Plus, you have to have a qualifying disability. So what else is out there for you? There's additional coverages, and we're going to talk more about those in a later episode. But I hope that with this information, you were able to learn a little bit more. And if you have questions, you are always welcome to reach out to me. My number is 512-599-9527. You can also email me at Mackenzie@premiermedicaresolutions.com. Now, there's no right way to go about getting coverage. There's only what's best for you. So as we move through talking about Medicare and the different parts, I encourage you to keep an open mind, because what your neighbor has, or what your partner or your spouse has, or your kids, or your doctor, what they want you to do, may not be what is best for you. So keep an open mind. Try to not come into this with any sort of preconceived notions. And if you have any questions, please reach out. That's what I'm here for. So you can call and text that number, and you can get this podcast, obviously, wherever you get your podcasts. And so please be sure to follow so you're notified about the next episode. Well, thank you very much. Thanks for listening to another episode of the Medicare Matters podcast with Mackenzie. Please make sure to subscribe wherever you get your podcasts so you don't miss an episode. Please also leave a review, as that helps me reach more people that can benefit from this podcast content. If you have questions or topics that you want me to cover for a future episode, please email them to Mackenzie@premiermedicaresolutions.com.